Good morning, everybody. Let me introduce myself. My name is Akhmad Edy Purwoko. I graduated as a doctor in 1991, a master's in 2002, and a doctoral program in 2019, all in Gadjah Mada University of Yogyakarta, Indonesia. I started working as a general practitioner in primary healthcare in 1992 to 1995 in Kalimantan. In 1995 to 1997, I worked in a private hospital in Central Java, Indonesia. I became a teaching staff in the pharmacology department of the Faculty of Medicine and Health Science at the Muhammadiyah University of Yogyakarta from 1997 until now. And at the same time, I also worked at the Muhammadiyah Hospital Emergency Unit in Yogyakarta. What inspired me to pursue a career in medicine? Medicine is a profession that the community needs. Therefore, I try my best to provide services to those who need them. What my specialization and why did I choose this area of specialization? I am concerned about studying pharmacology. I like pharmacology because knowing how drugs act and the effects of drugs in the body is essential to choose the right medicine to get the expected effect. Still, we can avoid unwanted side effects, especially side effects that we can predict will happen. For example, we face a patient with nausea and vomiting and must give antiemetic. Antiemetic have a mechanism of action to inhibit dopamine receptor in the brain. If we provide an excessive dose of the drug, it will suppress the function of the inhibitory neurons so that it can cause extrapyramidal symptoms. So you can choose the medicine according to the indication and give it to the patient with the correct dose. In addition to knowing the mechanism of drug action, understanding the pharmacokinetics of drugs is very useful. Certain conditions will affect the process of absorption of transmembrane drug transport and elimination. For example, grapefruit an inhibitor of the protein transporter uptake pump in the gastrointestinal tract, will reduce beta blockers bioavailability. Changes in gastric acidity due to the presence of antacid, H2 blockers, or proton pump inhibitors will reduce the absorption of weakly alkaline drugs such as ketoconazole, itraconazole, and others. And in newborn and elderly, the metabolism and elimination of drug may be different with adult. What is most rewarding about being a medical faculty or professional? The medical faculty is a place to educate students to become a doctors. Science develop very dynamically. So by working in medical faculty, we will continually adapt to the development of this knowledge. At the same time, as medical professionals, we can help a person or community who has health problems to overcome them so that they can live a better life, and we will also get a better life too. What challenges do I face in the teaching profession and are in clinical practice? Science and technology are continuously developing, sometimes very fast. So We must continually adapt to the changes happening. Moreover, as academicians, we must act as agents of change toward science and knowledge to obtain renewable technologies. In clinical practice, the medical profession is demanded by society to provide the best service with the latest technology. Therefore, as medical professionals, we must always be lifelong learners to adapt to scientific and technological advances in providing the best health services to the community. How has the medical field changed since I started my career? We know many changes have occurred in the medical field in medicines related to the use of therapeutic modalities of drugs and various medical techniques. Pharmacogenetic or pharmacogenomic developed more quickly after the completion of the Genome Project in the early 2000s. This science directs the individualization of therapy. Due to the existence of genetic variation that affect the pharmacodynamic and pharmacokinetic of drugs. What advice can I give you if you consider a medical career? And for the interns, if you are considering a medical career, you should pay attention to the knowledge that forms the basis of your profession. You must be prepared to become a lifelong learner to adapt to the ever-evolving medical science and technology. For the interns, I advise them to practice as best they can in clinical practice under supervision, so that they are truly skilled and professional in treating patients. Providing appropriate therapy with good skills will get healing results as expected and give satisfaction to the patient they treat. In my opinion, what are some significant changes or advancement in the medical field recently? There have been happened many changes or progress in the medical field in the last decade. As I said earlier about pharmacogenetic or pharmacogenomic, also mentioned in referral MD in www.getreferralmd.com, primarily related to pharmacology. There is a neurostimulator for treatment-resistant epilepsy and treat medication-resistant depression. Personalized drugs to treat a disease, genomic editing, and others. And the last, what I should tell you as a medical professional. Medical professionals should carry out their work according to ethical values. The development of science and technology and its application to human life to overcome or resolve health problems should rely on moral values. Al-Keba et al. From Saudi Arabia published their study about the significant medical ethical challenges facing the public and healthcare providers. There are 10 major ethical issues for medical professionals, include patient rights, equity of resources, confidentiality of the patients, patient safety, conflict of interest, ethic of privatization, informed consent, dealing with the opposite sex, beginning and end of life, and the last, healthcare team ethics. Well, this is what I can say. Thank you for your attention to my introduction.